put up the chair. Let's put it back. Cool. Well, how many are here? 1, 2, 3, 4, 8. Well, good. At least we're recording. Well, welcome to Anatomy Evening here in Erfurt, Germany. The first 5 minutes of this talk, I'm just going to show those of you who are interested, or some of you, who's already registered for the Module 1? Are you in Module 1? Yes, I thought. I just saw that today. You as well, Anita? Cool. So I'm just going to show you the materials for like a moment, and then I'm going to give the day of anatomy, which is the same teachings that I give to all of my teacher trainings of 200 hours, except that today, instead of using basic materials, I'm going to use these materials for that occasion, for this occasion. Okay, that's the difference. But I'm not teaching what's really in this course tonight. I just wanted to show you that Module 1 of the 3 modules that make up the 300 hours that I call my advanced teacher training, I have Module 1, which is called Math, Massage, Anatomy, Adjustments, Therapy, Healing. Talk about that in a moment. I have a Module 2, which is on meditation and Raja Yoga, so it's essentially a deep exploration of Raja Yoga, meditation, and a training dedicated just for that. And then the third module is nutrition and basically all of the rest of the information that you need to know to help people. So let's focus on Module 1, which is what I'm offering here, as you guys know, and as you just mentioned, a couple of you are already in it. So we have, I think, 5 books here. One of them is just dedicated to the sequence itself. This is the sequence itself, I believe, right? Let's scroll down a little bit. So just like the yoga teacher training has an official sequence, we have an official sequence for the math module. So you're going to learn how to do, it should be about a 1-hour bodywork session on somebody, okay? Every day we're practicing. Let's go down a little bit further. It involves a lot of Thai massage moves, but it's simple enough, and it's simple enough that it can be learned, okay? I know it looks, like a lot, and it is, but we do it every day. Just like the yoga training, we do it every day and we learn it, okay? Okay, so let's come out of this. So there's actually a sequence. So when we say massage therapy, we're giving you an actual professional sequence when you're finished. There's also a coloring book manual. Okay, so let's look at this one for a second. This is something else. Okay, go down. What this is the textbook for the massage therapy. Okay, so massage therapy has its own textbook. Remember, massage, anatomy. You don't just get a sequence. This is an entire textbook on massage therapy from my 2 teachers. I took this content from their manual. Let's look at this real quick. So we're going to be learning all of this, okay? These are all skills, okay? And as you go through it, you'll see, you can just scroll through it really quickly, it's fine. Keep going nice and fast, but not that fast. So you'll just see skills and examples, and so this is a whole manual about this. Let's go a little bit more further, yeah. Okay, so you get the idea? This is a big book, only dedicated to massage therapy skills, okay? So let's look at the coloring book. This is part of the homework. Okay, so the homework, we have these materials as well, some coloring, basically to, because there's a lot of anatomy. This training I have right now, I'm only showing the massage part, but this is getting to the anatomy part. So this is just a coloring book. It's given to you. It's pretty cool because it's yoga poses. All right, and you can see. Let's go down deeper into it, and you'll just see that. Go all the way down if you don't mind, like halfway through it. It covers all the material that I'm covering, okay? So we're going to be looking at all the bones, all the muscles, and this coloring book reinforces it, okay? All right, so that's this as well as a manual that you get. And then the last thing I want to show you is what we're going to look at today, which is the actual manual itself. All right, so... yeah, you can go into the beginning. This is a very substantial book, okay? Covering 140 muscles, I believe, or 170 muscles. Each one, let's go look at one muscle if you don't mind, like go kind of like about a third of the way and you'll see the muscles. No, all the way down. You'll start seeing muscles even farther down. Because there's all the bones first. There's all bones, bones, bones. Bones, 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 bones. Okay, that's ligaments, ligaments. Now we're looking at muscles, okay? So every muscle is going to be like this, okay? With different angles, okay? With understanding where does it start and where does it end and what does it do, okay? So, you just look at a few other muscles and you'll just see the 160 muscles that we're doing is going to be like that. Okay? Does that make sense? And that's the module. So it's a lot of anatomy, a lot of massage therapy, and then in the morning, in the morning when we're going to be doing our yoga practices in the morning, we're going to be focusing on adjustments. Okay? So that's what module 1 is. For those of you who are already in it, I'm super excited for you because I personally feel that if you're going to be a yoga teacher, this is the information that you need the most. Besides the how to teach, downward dog verbally, it's understanding what does somebody look like in downward dog underneath their skin. Like what are the joints doing? What are the muscles doing? Where do they connect? If someone's injured, how do you know where to target? Well, you know where to target because you know where it starts and where it ends, and so you can see it. And it's not just like something that, oh, well, does it hurt? No, this is specific, and then you're given the skills. Because, part of the massage therapy training, if you go back just for one moment to the actual massage sequence, I think that I wanted that right. Yeah, the new M.A.A.T.H sequence. Is that it? No, the other one, on the revised official M.A.A.T.H sequence on the right, that one. Yeah, and if you go to the bottom, you'll see, these things here, Fred Busch's techniques. Yeah, so it's not just like stuff you can learn. This is where I teach you the things that I use to heal people in yoga, okay? So that's just a small section of this, but it's a part of it, okay? And it's just giving you the real tools that you need to help students over the long term. Now, I think I mentioned, or I don't know if I have, but I mean, as a yoga teacher, you can never stop learning. You know what I mean? And although we all do a yoga teacher training thinking that it's the university level of yoga, I think I'm hoping to encourage you to realize that this 200 hours is the kindergarten of yoga. It's what opens our eyes and starts the process, and so we can see the landscape, but really got to keep investing and keep learning. I went to school to learn this. I went to school for 6 months, took out a loan with a bank, you know, to go to a school for this, you know what I'm saying? So, and then I have also, as you know, invested money in my whole career in teaching and learning. So those of you who are here have already figured that out, right? You've invested and you're here. But you know, the fact is that if you ever stop learning, your students will start to learn more than you, and that's not good for teachers. Does that make sense? So as teachers, we have to always keep learning so that we stay ahead of our students, so to speak, and we can always be of help to them. Nothing is more powerful than anatomy. Nothing is more powerful than massage therapy when it comes to being a teacher, because your hands are your instrument, and the knowledge that you have behind your hands informs your hands. Right? Doesn't that make sense? Okay, cool. All right, so that's it. Just wanted to give you that little, you know, introduction to Module 1. We're going to now go to the manual, and we're going to go to the spine, and I'm going to start to, now you need notes now, okay? I'm going to start teaching all the stuff that's in the curriculum that is on day 7 in your curriculum, and then also day 10 in your curriculum. All of it's going to be covered today. Ooh, and I also have my friend. Ooh, my half a friend. Guys, don't forget to take little videos and little pictures of me teaching as well. Helps me for promotional sake and also for your stories or whatever you're doing. And feel free as well to video, although I'm making an official video for the people that are not here, so I will give it to you. Excellent. Okay, so the first part of anatomy is learning the bones. Okay? We're going to start with the bones. We're going to start with some pretty general stuff. In fact, we're going to even be even more introductory. Let's go to the beginning of this manual where it's going to start saying, even more to the beginning. Yep, let's go to the very first things. Now, we're not going to do all of these pages, okay? This is the other training, but there are some things that are quite important here. So let us stay on this for a moment while Johanna does the video with this and the marketing 101, okay? So, cool. Now let's go down to where I want to be, which is here. Okay? Starting off gentle and easy with terms, okay? Terms. Let's get started. When we say medial, we mean closer to the center of the body. When we say lateral, we mean away from the center or the midline. Medial, lateral. When we say proximal, we mean towards the trunk. When we say distal, we mean away from the trunk. Now these are relative terms. First of all, why do you want to learn these terms? Why do you want to know distal, proximal, superior, inferior? Why? Well, because if you ever talk to a physical therapist, if you ever talk to a doctor, if you ever talk to anybody about either your condition or somebody else's condition, they're going to use medical terms and they're going to use anatomical terms. So you have to understand these words if you want to be able to, relate to professionals in the healing and in the therapy and in the medical fields. All right? So what I'm saying, these are relative terms. My fingers are distal to my wrist. My elbow is proximal to my wrist. You see, they're just relative terms. Superior means above, inferior, below. Okay, again, relative term. The head is superior to the neck. Okay? Nothing can just be superior to something unless it has something else. Anterior is the front of the body. Posterior is the back of the body. And then we have these Latin words for the same thing, where we have ventral, which is the front of the body, and dorsal, which is the back. Okay? And that's easy in English for us to learn in English, because in the dolphins, the fin on the back of a dolphin in English, that's called the dorsal fin. Do you have that word in German? Dorsal fin? Anyway, it's the fin that's in the back, so we just can remember that. Anyway, superficial means towards the skin, and then deep means inside or away from the skin, deeper. Okay? So those are some basic terms. Let's go to another page down. We'll learn this in Module 1, okay? This is too much. But let's look at this just for a moment. 3 what are called planes of movement, okay? There's 3 planes of movement. Now, I got to be honest, I don't necessarily use this information very much, but it's fundamental that it's taught, and use it or don't. The sagittal plane is this one here, that's cutting the body in half, okay? So, you know, these are used a lot of times in highly medical situations, like dissections, and okay. But in this case, let's just look at this. Sagittal plane is cutting the body in half in this way, whereas the transverse plane is cutting the body in half in this way. Okay? So you can see Warrior 2, as opposed to Tanasana, it's cutting it this way as opposed to that way. And then there's another plane called the transverse plane where you're cutting it this way. Okay? Transverse plane, sagittal plane, and then the other one was, go back up for one more, please. So where you were? There. Okay? And frontal planes. Okay? Again, you just take the notes and learn it, but I can't say that I use this information every day. I don't. Let's go to the stuff that we do use every day. So this is 2 very important words here and 2 more here. Okay? And then there's another word up there. Let's look at all these and here. These are all different kinds of movements of the body. Let's look at what they are. Okay? Starting with abduction and adduction. Okay? So, if I'm here and I take my arms like this, or my legs like that, if either one of those happen, that's called abduction with a B. Abduction. It's going out. If they already were out, and now I want to bring them in, that's called adduction with 2 D's. Okay? In fact, you have a group of muscles that are along the inside of your legs. And they are the muscles that, what do? They bring your legs together. You know what those muscles are called? They're called adductors. Okay? The whole group is called adductors because of their action. Now, if my hand is here and I roll them out, this is called supination. Opening the hand is supination. If I close my hand, that's pronation. Okay, and it makes sense because, remember, supine means face up. So this is supination, going to face up. And prone means face down, so pronation to facing down. Okay, and then you could have, here, okay, eversion is my feet pointing this way, inversion is, okay? Eversion out, inversion in, and then circumduction. These are all actions of the body, okay? All right, let's see, thank you, the next one. Okay, all right, let's look at these words. Flexion and extension, okay? Very important words that we see a lot. So they have definitions. Now flexion is when the joint, the angle of a joint gets smaller, flexion. So anytime an angle of a joint gets smaller, so this is flexing my wrist, this is flexing my elbow, okay? This is flexing my knee. If the angle gets smaller, flexion. If the angle gets bigger, that's extension. So I am extending my fingers. The angle of the joints are getting bigger, okay? All right, we've seen everything else. With the foot, they have special names for the foot. They have dorsiflexion is when you pull your foot up, and plantar flexion when you pull it down. Okay, and that's just only for the foot, where both moves are termed flexions. Okay, dorsi going up, plantar going down. All right, so that's cool. Some more actions of the body. This is all just basic stuff. You can keep going down, that's okay. It's fine. Okay. All right, Doug, if you wouldn't mind, let's go to one more down. Right here, that's good. One more down, please. I know I keep saying down, but what's up or down? The next slide down. Keep going in the direction. No, that's up. For me, that's up. Down, that's down for me. Yeah. One more after this. There. This one. Thank you so much. Amazing. All right. Well, we're going to start to talk about the skeleton. And as we talk about the skeleton, we're going to talk about bones and joints. Now, the Western anatomical division of the body is in, firstly, skeletally, and the skeletal structure is divided like this. They say that we have an axial skeleton, and what we're looking at is the part in white, okay? So the axial skeleton is the part in white, and the axial means the central part, okay? So the axial skeleton is all of the white, the spinal column, the rib cage, the neck, all that, and the head, and the skull. That's axial. Appendicular are the appendages. In English, appendages means the thing sticking off. The arms and the legs are the appendages. Okay, so the appendicular skeleton is everything that's not central. Okay, simple enough. Let us continue to... We are going to come here in a moment. In order to get here... Yeah, let's just start here, actually. That's fine. Let's start here. Okay. We're going to talk about the bones now. You have to know all of the bones. You don't have to know all of the muscles, but you do have to know all of the bones, even for this course. Because the bones are easy, and they're really fundamental. So even in this course, we learn all the bones, okay? But not to a totally intense degree that we will learn in the other training. So for example, for now, if you could scroll halfway down, right, and give me the head here of this guy. No, just like that, but down. Yeah, and keep going, but nice and slow. Yeah, slower. Yeah, stop. So I have the head here. Yeah, that's what I want. Amazing. All right, so here, look. Generally speaking, there's a lot of these bones, but right now we're not going to learn them. We're going to only learn this as the skull. Okay? So for your training, skull. But the one bone that we're going to learn as separate is the mandible. The mandible is the jaw. Okay? Nice. Okay, so we'll look at all these in Module 1 specifically, but now skull, mandible, and that's it. Okay?
Recording in progress.
Now, we're gonna go to deeper in the book where you see the where you were before, where the skeleton, the spine was. It's pretty deep down. It's after, there. This is what we want. I'm going to spend some time on talking about the spine. Okay, let's spend some time talking about the spine. Normally, I even have my paper and I write a lot of things down. In this case, you have to write it down for yourself. The spine has 5 parts and 4 curves. 5 parts, 4 curves. Cervical, thoracic, lumbar, sacrum, coccyx. Each one of these has a specific number of vertebrae. Okay? I do not recommend trying to find this stuff in your notes yet. I would just take as much notes as you can and then find it later. But there will be a time when we have to get on the skeleton and I will make sure we're on the right page. What page is that? Okay, eventually that is, if you have your books printed, or if you have your thing, we're going to be going there, but not quite yet. Okay? We're going to stay here for another moment, and then we'll get there. Every one of these sections, of course it's one thing. It's obviously one unit, or one, structure, but it's divided into those sections. Oh. Okay. So, 7. There are 7 vertebrae in the cervical spine. 12 thoracic. 5 lumbar, sacrum, coccyx. So we can look at him or her. So there's 5 parts, but there's 4 natural curves, okay? So the spine is not straight, the spine has curves. The first curve is here at the neck. It's going in, okay? When a curve goes in, that's called lordosis or lordotic curve, inward curve. Here at the cervical, meaning this is the outer curve, at the outer neck. This is the 7th cervical vertebrae. C7 is the one that sticks out the most. I'll tell you how to count in a minute. And then you have the thoracic down here and another curve here, your lumbar curve, and then your sacral curve. So curve, lordotic curve, kyphotic curve, lordotic. So in, out. 4 curves, 5 parts. Cervical, 7. Thoracic, lumbar, sacrum. Now, how do we use these numbers and identify them? Well, it's going to be a letter plus a number. Okay, so C1 is the first cervical vertebrae. Okay, so C1 is the first one, C2, C3, C4, C5, C6, and the one that sticks out the most is C7. Then start the thoracic, T1, T2, T3, all the way down to T12. After T12, start lumbar. Nice. So lumbar, 1, 2, 3, 4, 5. And you see the different angles here. There's a nice image. Okay? And then the sacrum and then the coccyx. Okay? So 7. Now, cervical spine has another name. Cervical spine is also called what? Your neck. Okay? That's the neck. The thoracic spine is called the thoracic spine because it has the ribs. Thorax means the ribs, rib cage. and the lumbar is your lower back. Now, where do you find most injuries in yoga? Now, I'm going to tell you a rule, okay? So write down this rule. Ready? Always, the more range of motion a joint has, the more potential for injury of the joint. Understand me there? So, I mean, I'm going to explain it, but let's just get it. The more range of motion that a joint has, the more potential for injury. Like I said, this is just a fact, which is why I told you already that hyper-flexible students are actually quite vulnerable because they have a lot of range of motion, a lot of joints, and then that makes it possible to get into trouble. Because the more range of motion you have, the more things you can do, the more things you can do to get yourself in trouble. Okay, now, look at the spine, and you see, and I asked before, where are most injuries? Okay, Stefan, what was you saying? Most injuries in the spine are where?
On the lower back.
Okay, and his vote is the lower back, and that's an excellent vote, and I agree with that. Where is the other location that you find a lot of injuries in the spine? In the neck. That's the other correct answer. Okay? So there's two correct answers there. Where are the most injuries in the spine? Well, in the neck or in the lower back. And why? If you can go back up to another page, to the other image there. Yeah, right here would be nice. Let's look at here. You see? Well, here you notice something, and here you notice something. Well, what do you see here? What are these called? Huh? These guys. What are they called? Ribs. Okay? So your thoracic vertebrae have ribs. The rib cage, which is maintaining their stability because they can't move very much. See, your spine cannot move very much when it's got the ribs connected to them. Does that make sense? But your spine can move a lot in the lower back, and it can move a lot in the neck. And this is why we see a lot of injuries in here and in here. Okay, now, I will describe what is a herniated disc in a moment, but let's just finish this conversation for a moment. All right, so 7, let's go back to that other image, it's okay. All right. All right, this is a nice picture to show me my intervertebral discs, okay? So look, you see it goes vertebrae, which is the bone. This is overwhelming. All right, well, it goes vertebrae, which is the bone, and then inside or in between are the discs. They're called intervertebral discs. Has anybody heard of a herniated disc? Yes? Pretty much everybody, right? Okay. Well, does anybody know what a hernia is?
Hernia is when like the muscles open in the lower of the belly, so and the guts they like push through and
Okay.
beneath the skin and the muscles.
Okay, so he is describing a specific hernia in a specific location. In this case, he's describing an abdominal area hernia. But did you know that you could use the word hernia and not talk about the location? It doesn't say a location, hernia. Did you know that? Because hernia is not specific to a place. It is a situation. A herniation is when... let me know when you're good with this. Got it? Okay, so a herniation is any time something that is supposed to be on the inside is sticking out In other words, the membrane that's supposed to contain something has broken. And what is on the inside is now was supposed to be on the inside is now on the outside. That could happen in many locations in the body. As Stefan was saying, there are hernias that are in the abdominal. These are called hiatal hernias, usually. There are hernias here that are called inguinal hernia, meaning the inner thigh hernias. People that lift things, they get these, okay? And then, of course, there is the herniated disc, okay? Which means that the membrane of the disc broke and the inside of the disc is now sticking out. And it is going to be sticking out in this direction, okay? That way, towards the back. Now, the thing is that running through this system, now you don't see the hole, but I mean, you can kind of see it here. Running through the whole spinal column is what? What's running through up and down here coming from your brain? What's going on? That's called what? Your spinal cord, right? Okay. Well, your spinal cord has different kinds of nerves. 3 different kinds of nerves are coming through here. That's 3 different kinds of information that are being transmitted through the wires. One of those types of nerves is called a sensory nerve. It means the kind you feel. Pain. Now, if this herniated disc pushes out and the outside is on, the inside is on the outside, it's out, it's here now, it's pushed out, and it touches a nerve. Now you have back pain. You understand that? If this herniated disc comes out here, but it doesn't make contact with a sensory nerve at that moment, you don't know that you have a herniated disc because you can't feel it. Understand? That does not mean that it's not affecting your nervous system, because it could be touching a different kind of nerve. The kind of nerve that's telling your liver what to do. The kind of nerve that's gathering information. There's different kinds of impulses, but if you touch the sensory nerve, you're going to feel it. If you don't, you're not going to feel it. That is a herniated disc. Understand that? Okay? How do you get it? By doing stuff with bad body mechanics. Remember the word body mechanics? How do you use your body? So if I go and, and put that kind of pressure and do it hard, then I can break the membrane, and then the disc sticks out, and then it touches a nerve, and now we have back pain. But many people have herniated discs, and they don't know it, but they're very vulnerable to have it get worse or have it get degenerate more. Okay? So that's my little discussion about the spine. Let's see. Okay, this is for the other modules as we get into the details. Okay. Now, let's go to the rest of the bones. Let's go back to the main skeletal picture, which will be the general. Now you guys can go to, if you have your book, it's okay, although I know it's dark. Let's start here. Now, I'm not going to say, yeah, this is probably even easier because it's a bit more simple. Let's go with this one because it's easier. All right, so we're going to learn the bones. Can you drop him down a little bit towards me? Yeah, so I can talk about this area. Yeah. All right, awesome. Here we go. This is the front of the body. Although I might mention the back. There's only one bone on the back that's not here. That'll be easy. Clavicle. Okay, clavicle. Yeah. Sternum. Okay. And then it's not shown here, but let's just say it now. Oh, you have it? Scapula? Okay, scapula. Okay, cool. That's really the only one that's only on the back for now. All right, so we have clavicle, we have sternum, we have scapula. Now let's move down the arm. Okay? And the main bone of your arm is called your humerus. And then your arm, the one big bone divides to two smaller bones. Okay? And the two smaller bones, if you open your hand, you could feel what's going on here. And the one that touches the thumb is called radius. The one that goes towards the thumb. Whereby the one that touches your smallest finger is called ulna. So that if I were to ask you, which bone is your elbow point? Which one do you think is your elbow point? You know? This thing that you can touch? Which bone is that? Anyone know? Right, but feel it. What does it feel like? Which bone does it go to? Can you feel that it's one bone going all the way to the small finger? Okay, yeah, this is the ulna. Okay, this is called the olecranon process of the ulna. Now, excuse me. The two forearm bones become the wrist bones. The wrist bones are called carpals. A very unfortunate name given to the irritation of the muscles of the wrist. Have you ever heard of something called carpal tunnel syndrome? Doesn't that sound serious? I mean, God, you got carpal tunnel syndrome. To me, that sounds very serious, you know? But it's just another example of the medical world using names to scare you into, I don't know what, getting some sort of injection. Carpal tunnel syndrome just means your wrist muscles are inflamed. That's all it is. Why are they inflamed? Well, repetitive stress or even bad diet could do that too. The bones of your hand are called the metacarpals. Oh wait, questions? Let me know. Fire away. If you have questions, fire away. Anybody have questions? No? All right. Well then. Was there a question? Can I put my sunglasses for this presentation? Was there a question? No? Everyone clear? Moving forward? Okay. Metacarpals are your palm of your hand, are the metacarpals, and then the fingers are phalanges. Each finger has 3 phalanges, except for your thumb, which has 2. Okay? Little bones and little joints. Okay? On the very first day, or one of the first days, I taught you about the 3 bones that make up the pelvis. Here they are. The pelvis is the ilium, the ischium on the bottom, and the pubis on the front. Okay, now of course it looks like one bone. It acts like one bone. It's essentially all fused together. The only time it moves is in childbirth, when in the females this opens up a bit. In men, it's very much doesn't move. Okay, I mean it's a different thing. In men, it's much more dense and it has no reason to move, so it doesn't. But this one does have the potential to open up a bit in childbirth. Otherwise, the whole thing is just one structure. But anatomically, Western people love to divide things and name them. So here we have 3 things: ilium, ischium, pubis. Now we can go to the legs. Okay. The biggest bone in your body is your femur. That's your big bone, femur. Let's go down a little bit if you don't mind, so we can see the rest of the lower leg. Yeah, that's fine. Your kneecap is called the patella. Now you have your foreleg, or your lower leg, we call it in English, the lower leg. I know this anatomy very well. Do you also have surgery here too? You had surgery here? Yeah, me too. Okay, so this is the tibia, which is the big one on the front and in the middle, the tibia. And then the smaller one off to the side is fibula, or in Latin they call it peroné. Okay? Of your own surgery, of your own knee? Yeah. Yeah, well, I know as well. All of this, I have screws here and all repaired here. All of this, for me, was shattered. Many pieces from something. So if you notice that the entire knee is the tibia, okay? The fibula is not involved in weight bearing. Only the tibia is. Fibula is off to the side. If you broke your fibula, you could still walk away. Okay? If you broke your tibia, like I did, you collapse. Okay. Now you have the bones that make up your ankle are called tarsals. And the bones that make up your foot are called metatarsals. And the bones that make up your fingers, your toes, are also called phalanges. Okay. Very good. All right, let's look at this for a moment. These are the two important type of joints that we see most of our injuries, and mostly involved with these joints, specifically the first two. Ball and socket is one, and hinge is another. I think, remember we talked about this when we talked about the lotus pose? Who remembers that? Who remembers me describing this in the conversation about the lotus pose and knee safety?
It's like a range of joint.
Yes.
And in lotus pose, we kind of twist joint in a way which is not dedicated.
Which joint? Come and tell me.
The knee at least will be like.
Huh, come show me. Come and do the projector thing.
It's like this would be, for example, the knee.
So this is the knee, okay.
I would try to like rotate it that way, which is not dedicated
Why?
for
Why?
lotus pose.
But why? Why would that happen in lotus pose? Why?
Because I'm moving that and I
Why?
try to move it that way. And
Why?
this is why?
Yeah, why?
Because I'm lifting up my feet higher than the no?
No, but you've got the second half perfectly right.
Yeah.
We're just going to get the first half. Okay? Have a seat. Who knows the first half? Oh, you know the first half?
My knees are a lot higher than the back.
Nope, that's about sitting. That's a good guess, though. Okay, he's bringing some different things together, but he's got the last part, which is the damage thing. Who knows the first part? From the conversation you guys have to recall the information I teach you. Okay? You can't just write it down and forget about it. So now, who wants to tell me? Why do people have their knees damaged when being forced to do lotus pose? Based upon what I already told you and these pictures here. Can anybody come up here and help me out with a review? You want to look at your notes? I'm not going to accept you all just staring at me like you don't know what I'm talking about. I'm not going to accept that. Not in this case. I will wait. And I will wait actually all night until you come up with this answer. So let me know when you have it. Only one of you needs it. I taught all of you. So I'm asking about the relationship between the hip joint and the knee joint in lotus pose. He explained the second half. So he didn't explain why is the knee getting damaged. So either figure it out or we will sit here all night. And I will run to the bathroom while you do. You're welcome to discuss it amongst yourselves.
Das ist eine von den Fragen von diesen 200 Fragen. Ja. Die er jetzt gerade gefragt hat. Ja. Und das hat er ja letztens erklärt und dann hat er gesagt, genau, und da geht es eben immer um auch die Beweglichkeit in der Hüfte. Also er hat ja schon gesagt, die Beweglichkeit, aber du hast leider gesagt, die Beweglichkeit in den Knien.
Ja,
und nicht in der Hüfte. Aber du hast die Hüfte nicht angesprochen.
Die Hüfte nicht angesprochen, genau. Das andere war, dass halt einfach die Range nicht da ist.
Das ist die Antwort auf die Frage.
Das ist die Antwort auf die Frage.
Das ist die Antwort auf die Frage. Wenn du die Beweglichkeit in der Hüfte nicht hast, was auch von der Muskulatur oder der Anatomie in der Hüfte liegt, dann hast du...
Got it?
You got it.
Oh, that's so wonderful to hear. We can actually continue the evening. All right, so who's going to be the person who saves the day and come up here and tell me my answer? Who? Come on, volunteer. What's going on with the top thing and the bottom thing and Lotus?
The bottom thing is it's because of the range of the motion in the hips.
Yeah.
Because of two things: the anatomy in the bones,
Okay.
or the muscle structure.
Well, the bone structure or the tightness of the muscles.
Tightness of the muscles or the bones.
I'm pleased with that answer. That will work with me. So look, this is, what is this? This is the hip or what? The shoulder. And this is the knee or what? The elbow. Okay? Got that? Well, when we're talking about the knee, and that means this is the hip, if there's not enough range of motion in the hip, and the femur does not rotate externally enough, it doesn't do that. In this case, it would be that, right? It doesn't do that. Then, what Stefan describes is what happens. You get to force this to not open or close, but to twist. Why? Because this didn't do what it had to do. And that is the epidemic in what's going on with yoga and yoga poses. That it's an epidemic in the sense that teachers are forcing students into lotus poses or pigeons without understanding this, and then it hurts their knees. Why do I take knee injuries so personally and so seriously? Because, well, I will explain it now, actually. Your circulatory system, and I'm just going to take a moment, and I'm going to say it here, okay? Your circulatory system is your heart pumping your blood. That's true. But that's actually only half of your circulatory system. Believe it or not, the heart pumping the blood really is responsible for half of the circuit. And the other half of the whole circuit actually is being pumped through the mechanism of your muscles, that when you use your muscles, they squeeze, and when they squeeze, they're contracting the veins, and then they're pushing the blood through it. So imagine like you've got every one of your muscles is a pump. That is a mini pump pumping your fluid through your body every time you move? Well, I'm explaining that your circulatory system has two pumping operations. One, the heart, ba-boom, ba-boom, ba-boom. Yeah, it's doing a lot. The other is every time you use your physical body, you are bringing your blood back to your heart. Physical activity related to circulation. That means that if someone stops being able to walk because of a knee injury that they got in yoga 15 years ago, that's a big problem. Do you understand what I'm saying? That anything that threatens ambulance or threatens mobility is a very grave type of injury. And knee injuries naturally would do that. So I really, really prefer taking care of the knee. All right? Let's move on. And I think we're ready. This is not part of this training. However, I'll just show you one very important one. Let's come down a little bit. Well, I said down, I didn't mean it. What I meant was, I would like to see that coracoid process. Yeah, this. Let me get out of the way. Just want to show you, look, in the module 1, we're going to learn all these landmarks, okay? Because you have to know specific geographies, topographies of the bones. Like, the bone is big, but so if you want to describe something on the bone, you have to be able to know exactly where. Well, the exactly where part are landmarks, they're called, specific places on the bone. Well, one of them that's really important is right up here. I know that it's not that focused. It's actually a better picture is here. And it's called the coracoid process of the scapula. And I want you to know about it because your bicep attaches here. And yet, it's the scapula on the back of your body, and it's here. So when we talk about the biceps in a minute, because we're going to go over the muscles in a minute, when we do, it will be attaching onto your scapula, onto the coracoid process, which is right here on the inside. Although the scapula is in the back of your body, believe it or not. Okay, let's go to, let's see what's next in this book. All right, so now let's go to the muscles. The 5 main muscles that you have to know for this course are actually in your book. Let's see it. If you turn the page to the muscles, and then you're going to see some muscles, and then you're going to see 5 main muscles that you have to know. Biceps, triceps, quadriceps, hamstrings. You got it? Everyone got it? Okay, well, if everyone's there, we can start. Any questions yet before I shift into muscles? We're just going to learn 5 muscles tonight out of the 150 that are in this book for the next module. Biceps, triceps, quadriceps, our hamstrings, and iliopsoas are the 5 muscles that we're going to learn. When I say that we're going to learn it, it means that we're going to learn where does it start, Where does it end? What does it do? Where does it start is called the origin. Where does it end is called the insertion. And what does it does is called the action. Okay? Now this is the front of the body. Okay? So let's go, let me see if there's another image as well of the biceps. Tricep. Then go down one more. No. It's going to have to go back to where we were, the biceps. And then before that, is there anything, or that was it? Okay, cool. All right. So there's really, the thing with the biceps is there are two heads, but they both attach at the same bone. Okay? So for that reason, although there are two heads, they have the same answer. So there's a long head and a short head, but if you look at the bones, you see they both start at the scapula, different places, and they both end at the radius. So in that case, this is the easiest muscle to learn, because while there's two parts, they're the same answer. Where are they going? Well, they're either inserting at the scapula, here at the top, which is here, or at what I just pointed to, the coracoid process, which is here. And then they're both coming around and then meeting essentially, and then attaching here at the radius, which is here. Okay? These are both biceps are coming around and touching here. And what do? They flex the elbow. Okay? Elbow flexion, and then shoulder flexion too, because they attach at the scapula. Okay? So that's biceps. Keeping it simple here, not going crazy. That's simple enough. All right. Well, with triceps, there's three. And I think, let me see the other images, that we're going to see all images at some point. Okay, yeah. So we have medial and lateral. Okay. So we're going to look at all the heads in a moment, but just understand that tri means three. These are all muscles that extend the elbow. Extend the elbow. The longest head is going to go to the scapula as well. Okay? From the scapula to the, well, they're all converging here onto what's called the olecranon process of the elbow. Okay? Of the ulna. Okay? So this is the long head is going from the scapula to the ulna. The medial head, let's see it. The next one. These are triceps, yeah. There's three. The one in the middle is going from the humerus, okay, so no more scapula, now it's the humerus itself, to the ulna. And then the lateral head going from the humerus as well to the ulna. All of them are extending the elbow, and one of them is extending the shoulder as well. Okay? Simple enough for the triceps. That's good for right now. All right, let's see. What do we have here? Okay, now we're not going to. All right, the next one in our group here is going to be the legs. You got to go all the way down to the legs now. There we go. Quadriceps. There's 4 quadriceps. That's why it's called quad. They have individual names, okay? Let me see the other pictures just so I can see where we're going. Yeah. Most of the names start with vastus, okay? There's 3 that start with vastus. See? Vastus lateralis, vastus medialis, and then the other one, which was the first one, vastus intermedius. Okay? Vastus means huge. These are all the muscles that are here. And then, there's the 3 different strands. So let's keep on the vastuses for a moment. Down, yeah. Okay. So, all of the vastus muscles are essentially the same in what they do and where they start and where they end. All the vastus muscles begin at the femur on the leg and attach at what's called the patellar ligament, but it's really the tibia, okay? So they're really attaching on the tibia. So they're all converging and coming to here. All of the vastus muscles are the same, and they extend the knee. There is one different quadricep. This is the unique quadricep. And that is the first one that we see called biceps femoris. The other direction. Yeah. Oh, rectus femoris, yeah. Okay. So rectus femoris is different. It is going all the way past, you see? It's going past the femur. It's not on the femur. It's attaching onto the ilium. And as a result, rectus femoris, when you all do boat pose or you're all like trying to lift your legs straight and you feel this bump here, this is the ligament or the tendon of rectus femoris. Okay? I forgot to mention tendon versus ligament. So let me just make sure we have that. A tendon, like this, connects a muscle to a bone. So this is the tendon, connecting the muscle to the bone. But this, for example, here, is what's connecting a bone to another bone. Well, if it's connecting a bone to another bone, that's called a ligament. Okay? So ligaments, bone to bone, but if it's connecting a muscle to a bone, that's a tendon. Okay. Anyway, rectus femoris is the one that crosses the hip, and so it also flexes the hip as well as extends the knee. Okay? The hamstrings are the back of the legs, and there's 3. 2 of which are going to go to the tibia, and 1 of them is going to go to the fibula. 2 of them start with the word semi. So I think the next one you'll see will be semimembranosus. Okay, and then semitendinosus is the one we'll start on. Okay, so these are all attaching here at your ischiotuberosities. This is, of course, the back of the leg, but you see it's kind of doing an interesting curve around. Okay, semitendinosus. They say semitendinosus because it's like a tendon. It's thin and small. But again, ischiotuberosity to the tibia. What is it going to do? It's going to flex the knee. Flex the knee. And we know these are hamstrings, so they are intimately related to pelvic rotation. Okay, as well. Let's go to membranosus is wider, like a membrane, wider, but the same story. Ischiotuberosity to the tibia. The one that's different is biceps femoris. Okay, which is the last one. And biceps femoris, it's called biceps again because it has 2 parts. But this is the biceps of the legs. But really they both have the same answer. They're going from the ischial tuberosity to the fibula. Okay? And again, the same story. Flex the knee. Okay? Okay. Let's go to iliopsoas. I don't know where she is in this. Yeah, pelvic muscles. So those are the psoas. Those are, excuse me. Let's go down a minute just to show you briefly. Well, I don't know what I mean when I say down. I want to go where we just saw. Yeah, thank you. A little bit more. Because you're going to see the Mula Bandha muscles. Where are they? Right here. Okay. These are these circular muscles that are at the base of the pelvis, okay? We do, like all of these as well, okay? All right, but let's go do a psoas, okay? Was that it? Let me see the last one right here. One more. One more forward. Nope, other way. Yeah, here. What do we got? This is it. Yeah. Okay. So remember that psoas is a two-part muscle, ilio-psoas. Some people call it ilio-psoas. Some people call it iliacus and psoas major. Well, look at the size of it. First of all, it's just massive. Remember, this is what's connecting your hip. Excuse me, your psoas connecting your femur to your spine. Underneath everything else, your most core muscle, femur to spine psoas. You should know this already because you drew it. Okay? And then the iliacus part is the next one. Let me see the next one, the iliacus one. Okay, and that's here. And this is the second half, which is starting in the same place, the lesser trochanter of the femur, and going to the ilium. Okay, so one is connecting your leg to your hip, one is connecting your leg to your spine, and that is your iliopsoas. What does it do? Flexes your hip, as well as, of course, all of the important strength poses in yoga. Okay. Any questions yet? So for your exam, just so we're just clear about that part, you need to know the 5 muscles that I just showed you. Where do they start? Where do they end? And you need to know all the bones. You need to know what I told you about the spine, as well as what is a herniated disc. Okay, so all of that stuff that I had talked about. You also need to know about the fact that the circulatory system has 2 different pumping mechanisms, one of which is your heart, and the other one is your muscles, your skeletal muscles as you move your body. You know that animals in nature never take a day off. Have you ever noticed that? Or have you seen the National Geographic where the film crew, they happen to show up into the forest on Sunday and all the monkeys were on the ground? They didn't climb the trees because it was Sunday. You didn't see that one? Oh man, yeah, it was a special National Geographic for resting monkeys. You've never seen it. Because exercise and the moving of your body is inherent into the design of the optimal functioning of your body. In other words, your body is made so that unless it is moving, it cannot function optimally. And that is because of the role of movement in the circulation of all of our fluids. Does that make sense? So a day off of exercise is just the worst possible idea. Because it's like a day off of circulating your fluids and your I mean, when I say fluids, I mean blood, I mean lymph. I'm talking about, your endocrine system and your lymph. All of these things, movement is the key to this. And that's why I hate knee injuries. Because if a knee injury means somebody can't walk, it means a lot. Okay? It means that they're not going to be, it's not going to be that easy for them to stay healthy. Okay? All right. Now, there's another reason why you have to exercise every day, and for that I'm going to show you a video. Then I'll explain what the video says after he says it. Okay? This is a video on something called fascia. Has anybody heard of fascia before? Okay, well, it's a very overlooked and understudied element or factor in the body. Most teachers are talking about muscles and tendons and whatever they're talking about. But fascia is covering everything. And fascia is dividing everything. So I want to show you a video about fascia and then help you understand why, once again, we need to exercise every single day. One reason is circulation. One reason is going to be coming up with fascia. Another reason is your nervous system. In other words, like I said, your body is designed for exercise, like every other animal in nature. And if you don't give it what it is designed for, it doesn't function perfectly. When the brain does not function perfectly, that is called every single symptom you've ever heard of. Okay? All the things that the psychologists label as what you don't want, that's what it means. But if you don't exercise every day, how would you ever expect your brain to work at a high perfect function? It's not fair. I mean, you want your heart to work well and you don't exercise? It's not fair. Same thing with your brain. Okay? So, nervous system. Sleep. How can people sleep at night if they don't exercise? See that? And because you didn't get tired, all you did was get nervous energy and you didn't get to express it out. Yoga is the best exercise in the world. It's not the only one, but it is the best one because it's very unique. But what's important is that people do what they love and that they do it and they exercise daily. So, if you want to do yoga, then that's amazing and a good idea. But if you swim, you swim. If you run or walk, whatever, do what you love, but do something. Okay? Because the key to well-being for human beings is movement, just like for all other animals. All right, well, let's look at fascia. I'm going to show this video, and then I will explain what he's saying. Okay? Oh, no, I'm not doing that without my glasses, though. I have more than one thing to show you here, so let's start with this one. This is a cadaver. You're going to see dead bodies. Get ready. He's an anatomical specialist in cadavers and a master of anatomy, this guy. But what he's going to tell us now about fascia is very important. When he says fuzz, he is talking about fascia. Okay? That's equal for him. He's saying when he says fuzz, he's talking about fascia.
So here's the thing about the fuzz. I'm trying to do it to count. Okay. So we've seen the fuzz. You can see it now. I'll put it in over my voice. The fuzz yields to my fingertip. Sometimes I come across a stronger, thicker strand. It doesn't yield to my fingertip. That right?
He's saying the fuzz yields to his fingertips. In other words, he's passing his fingertips through it. The fuzz is like disappearing and it's breaking. Okay?
Represents older fuzz. Sometimes, or maybe it represents the nerve. But each night when you go to sleep, the interfaces between your muscles grow fuzz potentially.
Okay. Now I'm going to explain what he says with that picture up there. Okay? And then I'll let him finish saying it himself. But I'm going to just teach it first. See, what you're seeing is the area between two muscles. Okay? And normally for us, the areas between two muscles slide because they're designed for sliding. These are sliding surfaces of the muscles, including those two. But this is a dead body. And we don't know how long this person wasn't moving before they died. Well, anyway, every night when we go to sleep, both sides of the muscles grow a little. He's using the word fuzz. It's a good word. Microfibers, really thin, both sides. But it's only one night. It's only 8 hours. When you wake up in the morning, are you really loose and open and like ready to go dancing a party the first thing in the morning? No. Don't you feel a little bit tighter in the morning? Like you need to stretch? Isn't that true in the morning? Well, what you're feeling in the morning is this slight densifying of the fuzz, a little, but it's no problem. 2 sun salutations later, you did a couple downward dogs, and now you're sliding again. This broke through. Now you're sliding again. Well, cool, but what happens if you go a whole day without exercise, or 2 days? Well, what happens if you go 2 weeks, or 2 months? See, now what happens is that these fibers, which were micro and small, and you were shaving them off. Every time you exercise, you were cleaning them off and having nice smooth again, but now you don't exercise, and now they start doing this. And then the movement of your muscles becomes limited. But it wasn't limited because the muscles got tight. It was limited because the fascia got tight and dry, and now you can't move. It's like wearing tight jeans. And tight jeans, and you want to get on a bicycle, and you're like, you can't get on the bike, right? It's the same idea. You've got this thing covering you, but it's so dense and tight. So, then he's going to tell us, after that, he's going to show us that. Then he's going to say that what happens is this happens over time, and then the muscles get collapsed by the density, and now they have less range of motion. Less range of motion over time as a result of this. And he says that people mistakenly call that aging. And this is not aging. This is simply what happens when you accumulate days and months and years of not using your body. And I'll just tell you, you should know, the great difference between biological age and chronological age. Okay, so people assume or they believe that the reason why they have no range of motion and their body is degenerating, they think that's aging. That's not aging. It's what happens when years pass by and you do not take care of your system. How many people do you know are 60 and they look younger than 60? How many people that you know are 40 and they look much older than 40? Biological age and chronological age are not the same thing. Now, so he is suggesting that this is a mistake to think that this type of limitation is aging. It's not. It's just not moving your body. I already said animals in nature never take a day off, and nor are we. The best exercising, why is yoga so good? Because it has a stretching element to it. It's not just a contracting element. You know, if all you do is lift weights, it is good, it's better than nothing because you're moving, and all movement is good. But the stretching element of yoga is quite useful along with the strengthening element because of this stuff. Okay, let's keep playing.
And in the morning, when you wake up and you stretch, the fuzz melts. You melt the fuzz. That's the feeling you have. Is the solidifying of your tissues. The sliding surfaces aren't sliding anymore. There's fuzz growing in between them. You need to stretch. Every cat in the world gets up in the morning and stretches the body and it melts the fuzz. In the same way that the fuzz melted when I passed my finger through it. When you're moving, it's as if you're passing your finger.
Okay, can you stop it there? So he says it. When you're moving, it's like you're passing your finger through the fuzz. Okay, because you're breaking it up and he's calling it melting it. I call it shaving it. But in either case, you're making the surfaces smooth again so they can, not have that cotton candy, spider webby fascia density. Okay, go ahead.
So you have to stretch and move and use your body in order to melt that fuzz that's building up between the sliding surfaces of your musculature. The sliding surfaces, the shiny white surfaces of the rectus femoris sliding against the vastus intermedialis. So these sliding surfaces are all over your body. The fuzz is all over your body. And as you move, you melt the fuzz. Now what happens if you get an injury? My shoulder. My shoulder is stiff now. I'm holding my shoulder. I go to bed. I wake up in the morning. I don't stretch my shoulder. I'm afraid it hurts. It's all around because last night's fuzz doesn't get melted. I go to bed. I sleep some more. Now I have 2 nights fuzz built up. Now 2 nights fuzz with more fuzz than 1 night's fuzz. What if I have a week's fuzz or a month's fuzz? Now those fuzz fibers start lining up and intertwining and intertangling, and all of a sudden you have thicker fibers forming. You start to have an inhibition of the potential for movement. It's no longer simply a matter of going, stretch. Now you need some work. Now you might need to do a more systematic exploration of that place to restore the original movement that you lost. And usually this is the case. We have a temporary injury and we restore our movement. But sometimes we call this aging.
There it is.
Amongst the sliding surfaces of our bodies, so that our motion becomes limited, the limit cycles become introduced into our normal full range of motion, and we start to walk around like this. We're all fuzzed over. Our body is literally solidifying. We're reducing our range of motion in individual areas of our body and for our entire body in general. So I believe that one of the great benefits of body work, whether it be massage
Or exercise.
physical therapy, or any kind of hands-on therapy, these types of therapies introduce movement manually to tissues that have become fuzzed over through lack of movement, whether the lack of movement is because of an injury and the person's protecting that injury, or because of personality expression. I was many years when I was walking around like this, I was very still and calm. So, and then I became a little more dynamic.
right, you can stop it. Did you understand what he said? Yeah? Make sense? Okay, so this is another of the several reasons to exercise every day, because life depends on it. I mean, have you all remembered how it felt to not exercise in a day? Did you feel good that day? You can't. Like, you know what I mean? Like, if you've been doing yoga every day for a long time, and then you accidentally take a day off, which we don't do anymore, but in your previous life before, yeah? You know what that felt like? Well, now you know why. Because your body didn't circulate. You didn't oxygenate your body either. Talk about oxygenation and deep breathing. And your body's getting... It's like, God, man, like a day without exercise is not a good day. Okay? I'll leave it like that. Now, I got one more thing to show you. And then we will call it an evening. Cool, still got 10 minutes. Does anybody know who is Jack LaLanne? No? Yes? Jack. No? Yes? The greatest single master.
Man who will show you how to feel better, look.
The greatest master. Let me. When you're done, let me know. What's the debate here?
So she said that she also heard about that fascia also saves emotions. Like when there's
Sure,
tension
yeah.
to emotions,
Sure.
it's also a reason.
As long as you're exercising every day, then you could talk about emotions. Otherwise, don't. Yeah? First things first, but yes, then they are absolutely related. Everything is related. This is the greatest living, well, he's not living anymore, the original master of fitness, the first human. This was the guy who opened up the first gymnasium ever in Southern California. He's the one who invented the idea of physical fitness as a culture. This is Jack LaLanne. He is the original person who explained exercise, diet, and the mind. He was doing this in the 1950s. He had a television show for 30 years in the United States, every morning, designed for housewives who were stuck at home to give them exercise. This is the most inspiring human being I've ever seen in my life. Okay? Just knowing, just watching him makes me smile. Okay? Has anybody ever heard of this before? Do you know what this is called? A jumping what? Yeah, he invented it. It's a jumping jack. It's his. Okay? Just so you know how deep he goes. He was the original master. So first I'm going to show you what he looked like in his career. And then I'm going to show you what he did when he was 70 or 80 years old. And he lived to be about 100. Okay? So just a few minutes of this.
Look better, Jack LaLanne.
Good morning. Happy Monday morning to you. Thanks very, very much for letting me come into your home. You know, my name is Jack LaLanne. And I'm here for one reason and one reason only. To show you how to feel better and look better so you can live longer. Please, keep your dial right where it is because I want to become real good friends with you. You know, there has been so much talk of late about the importance of exercise, the importance of better nutrition, the importance of positive thinking. All of these things we are going to learn together. I like to consider myself as your personal physical instructor and your health consultant coming into your home every day. You know, and there's also many of you students who say, Jack, I know that I need exercise, but, well, it's too boring, it isn't any fun, and I can't do it, or I'm too old. These are all excuses, because I'm going to be here to show you how much fun and how easy exercise, well, I don't like to call it exercise, I like to call it trim neck.
Okay, so that's, you know, and you can see this stuff on YouTube all you want. I mean, I can watch stuff all day long because he's so inspiring, okay? And he's such a master of the mind, you know, and the way that he gives suggestions are just so powerful. Everything he does is right, okay? But now let's look at him a little bit later in his life, okay? I don't know what you like to do on your birthday, but
not exactly the kind of momentum Jack LaLanne needed for his little 1 mile.
I don't know what you do on your birthdays, but Jack LaLanne on his birthdays does things that are very special. Like one birthday, he did 1,000 push-ups without stopping. Now on his 70th birthday, which you're going to see now, his 70th birthday, he tied his arms and his legs like this, okay? So swimming, but with no hands, okay? So he's tied his hands like this, and then his legs are tied too, and then he ties himself to 70 rowboats, one for each of the years of the 70 rowboats to his feet. Then he swims pulling 70 rowboats for a kilometer. Watch. Nobody, for a kilometer. Even swimming 1 kilometer just for fun is a lot. Look what he does.
But he seeks the challenges. Remember, this is the guy who swam across the San Francisco Bay. The one who at age 60 swam from Alcatraz Island, handcuffed and shackled, to Fisherman's Wharf while towing a half-ton boat. Today, the task of towing 70 people on board 70 rowboats 1 mile on birthday number 7.
1 mile.
Water between 60 and 70 degrees. A piece of cake, right?
I haven't been doing that stuff when I was 15 years old. I was 15 years old, I committed myself, and that was it.
Once again, he was handcuffed and shackled. At a mile-an-hour clip. It would be more than 2 hours before it would be all over. In between start and finish, cheers and encouragement from friends and his wife, Elaine. What about his 71st birthday? Any more feats?
I hope not. Don't you get tired of this every other year or something?
Why did you yell that it's golden while you got it within earshot?
There he's looking. Doing fine, Jack. Hey, Jack, yeah, well, I can't school you now. I couldn't do that. I love him too much.
Go, Jack, go, his longtime friends yell, in between their sips of beer and drags out cigarettes. Finally, Patriots, one more accomplishment under his belt, and someone mixed in at the finish was the national anthem. He was cold, he was glad it was over, and never thought of quitting. Now what's next?
Paddling underwater.
Another piece of cake, no doubt. Joe Rico News 4.
Pretty cool, huh? I think so. All right, so that's it for now. If you have any questions, that's cool. Otherwise, we're pretty much at the end of this presentation. Okay, everyone feeling good? Got some anatomy information, just a little introduction. This is a very basic presentation. Those that are staying for the other module will go obviously much, much more in depth. And in either case, if you don't study with me more anatomy, please go ahead and try to find a way to study it on your own, okay? Doing a massage therapy course or any type of official anatomy training. Again, if it's not with me, you still need it, okay? Because as a yoga teacher, this is kind of essential stuff, yeah? It's not easy to learn it. It's not fun to learn it. It doesn't have to be fun or easy. It just has to be done, because if you're gonna help people in their bodies, you have to know anatomy as best you can over time, okay? So that's it. Any questions? If Feel okay? Yeah? Okay. All right, well, that's it. Have a good night, and we'll see you on Friday. And Friday is where? Is there. Okay? So Friday, 3 o'clock at the other place. Okay? We'll see you then. Correct? Friday is at Tango. Yeah? Okay. Got it. Good.